types of foot X-ray views. Types of foot X-ray views. There are several types of foot X-ray views. A standard projection is one that shows the entire foot from the front and the side opposite the affected side. This view is the most common and is the most straightforward to interpret. Typically, a person should stand up with an extended leg. A lateral view shows the entire foot, and should show both sides of the ankle. Both the metatarsophalangeal joints and the fifth metatarsal are clear. There are several types of foot X-ray views. The lateral or weight-bearing view is tangential and is often used to evaluate the foot's weight-bearing relationship with the leg. A lateral view is more useful in finding the cause of a condition because it shows the shape of a bone and its relationship to the rest of the body. It is also a common way to diagnose a fracture. Another type of foot X-ray view is the anteroposterior (AP) view. This view is the most commonly performed and helps diagnose a foot ailment or injury. This view is also called a dorsal plantar view. Anteroposterior X-rays are often used in orthopedic surgery. Aside from this, an oblique view is also helpful in detecting a fracture. The doctor should take 3 foot X-ray views, including an anterior-posterior view. These views are necessary for proper diagnosis. In addition, the physician will order a medial lateral view to evaluate the position of the bones in the foot. Having an oblique view is helpful to see if there is any bone growth or injury. Anteroposterior and oblique views are also common, but the posterior and lateral views are more detailed and comprehensive. A patient will have an anteroposterior view to observe the foot from all angles. Anteroposterior views are the most important to visualize the ankle mortise, which is the overlapping of the tibia and fibula. A medial view of the foot is also helpful to identify the medial elements and the Les Franck joint. The interphalangeal joints and metatarsophalanges are also visible in this view. The X-ray image of the foot is a black and white image. Dense structures are white, while soft tissues are dark. Usually, the X-ray is taken by an X-ray technician, usually in a hospital or healthcare provider's office. During the procedure, the foot X-ray is captured in 3 different angles. After the pictures are captured, the doctors will analyze the information and decide on the best treatment. A typical foot X-ray will show 2 views. Anteroposterior is the more common view, while the lateral is the more detailed view. The oblique and posterior views are the best for analyzing the interphalangeal joints. The lateral and anteroposterior axes are the best places to see the tendons and muscles. A good oblique foot X-ray will show the foot in its natural state. A weight-bearing lateral view of the foot is the most common view of the foot. This type of foot X-ray will show the articulations of the first metatarsal and the deltoid ligament. The oblique weight-bearing view is also the most commonly used. A sesamoid X-ray is used to diagnose sesamoids. It's important to understand the difference between the oblique and lateral views before deciding on the treatment. There are several types of foot X-ray views. The most common are the lateral, oblique, and dorsal plantar views. The anteroposterior view of the foot is a common X-ray of the foot, as well as the lateral view. A lateral view shows the foot from the side. The oblique and posterior-anterior views of the feet are more detailed. The most common view of the foot is the lateral view. If the oblique view shows a club foot, the talipes should be ruled out. However, the lateral and anteroposterior views of the foot should be done only if the child is not walking yet. The AP and lateral views are also important in diagnosing infants with talipes. Normal foot X-ray, normal foot Xray, normal foot Xray.